A medical emergency is an unplanned or unforeseen or unexpected event that happens to a person that if this person does not receive medical attention within the shortest period of time, it can cause either death or disability. Emergencies could be medical emergencies. So for example, someone has collapsed, or someone has had a stroke, or someone has difficulty in breathing. Or it could be an obstetric emergency whereby a woman is in labor and needs to go to hospital, or a pregnant woman is bleeding. Or it could be a pediatric emergency whereby a child starts convulsing or a child gets a fever. Emergency care is then this care that is given to this person so that we prevent death and we prevent disability. KCCA Emergency Medical Services therefore established a call center. These services are free of charge. We do not expect the people that we pick up to pay the teams that are picking them up.
Hello, KCCA COVID Emergency Response Centre. You're speaking to Fiona. How may I help you today? We receive a call. We enter them into the system that was actually developed by KCCA. We filter them according to emergencies. So when it is an emergency, we have to dispatch an ambulance. We see through the system which ambulance is available. We call that ambulance person and then give them the number of the patient so that the patients can direct the person exactly where they are.
From the point I receive the call, I must make sure that I understand what kind of duty am I going to execute, what kind of patient, what kind of distress is the patient in. So I have to make a plan and make sure that my ambulance is fully equipped and all my gadgets are in check. So when I receive the call from the center, so what I would do, I would call this client first, find out what the issue is, where they are. By the time we start moving, at least I have the closest point of where to start from and see how we can evacuate that patient. So it has to be as quick as possible because every minute that passes by is so critical, and I have to make sure that I keep the time and I save this life.
In emergency care, there's something called a golden hour. And a golden hour is the time from the time that emergency has occurred to the time this person should get medical assistance. So when a call is made, we ensure that we minimize as much interruption that will affect this golden hour. We have to ensure that we work as fast as possible so that we can respond within the golden hour. This is very critical because we don't want to make any delays that can cause further injury or cause death or cause even disability to this person.
We receive about 500 calls a day from within Kampala and the Greater Metropolitan. Some calls are from other districts like Mityana, Masaka, Mubende, Kamuli, Iganga, Jinja, Buyikwe, and some islands.
We receive calls from very many patients. For example, HIV patients. When an HIV patient calls in and wants a refill, what we do is we get the details of the HIV patients, send them to IDI so that IDI gets their drugs and then delivers them home. In case a patient is not from Kampala, IDI will connect to the implementing partner in that district so that these patients actually get their drugs and keep swallowing them.
When we receive a call from outside the metropolitan, we have a list of numbers of DHOs of different districts and district surveillance focal persons. So we link these people to the DHOs. We have a system that helps us to do that, and we indicate in our system that this caller has been linked to the district health officer of that district.
Because of the model that we have created to respond to emergencies, the DHOs of other districts can benchmark on this model and create a functional ambulance system for their districts so that we can reduce the number of deaths, but also the disability that these emergencies will affect on the people. Medical emergencies need timely and critical response. So we have to ensure that the teams are ready to respond as fast as possible. Our area of coverage as Kampala Capital City Authority is the Greater Kampala Metropolitan. Our call and dispatch center is operational 24 hours a day, 7 days a week. Our toll-free numbers do not require airtime. So please call these toll-free numbers in case you are in need of a medical emergency. And we shall respond within that golden hour and ensure that you are safely evacuated from wherever you are to the nearest health facility.
Thank you for calling KCCA Emergency Response Center. Have a lovely day.